When you have back pain, you don't do anything and take anything for granted. You think about how you're getting out of a chair. You think about how you're going to bend to tie your shoelace. You think about every single move you make. So it's absolutely life-altering when suddenly you can sleep the entire night through and realize that maybe you tossed and turned, but you don't have any recollection of it. For a good 25 years, I had what we generally described as sciatica issues, pain, sharp pain down the leg, and it would take your breath away, and gosh, you couldn't stand up straight, you'd walk hunched over, and it was just no fun. But more recently, the pain changed, and it wasn't so much sharp sciatica pain, but constant, never-ending pain in my mid-back, lower back, and down my legs. My bones in my legs hurt. Once we had the MRI, my wife and I came in and had a consultation with Dr. Bjerke, and he put it up on the screen and showed me the problem. And he said, you got a little bit here, but this is the bad boy right there. And he gave me options. He said, look, there's several ways we can go about treating you. We can just do nothing if that's what you want, and you can endure this. We can give you relaxants. We can give you physical therapy. We can do injections, or we can do actual surgery. So he didn't push, he just said, here are your options, here are the risks. And my wife and I were in total agreement that we're going to go get this surgery done. The first thing I remember thinking, though, when I came to was, I'm not in any pain. The next morning from the surgery, I was walking. Shaky, but I was walking. Without pain, I might add. Standing up straight as opposed to hunched. But about 4 days after the surgery, I was out in the neighborhood going for walks with my dog, and I was walking over a mile a day, and I have been doing it almost every day since. I want to just say, I told Dr. Bjerke, literally on my first visit post-surgery, that this was life-changing. I don't think people who don't have back issues understand it the way people who do have back issues.
A lot of patients come into my office and just say, hey doc, you take care of me. I don't even want to see the x-rays, just wake me up when it's done. And that's okay for some people, but there's a spectrum of sort of how involved people want to be. Ed had great questions. Ed was prepared. Ed knew his medical history. He knew his problems. He had researched the technique that I described to him after the first visit so we could talk about it intelligently in the second.
XLIF?
He had an XLIF, a lateral fusion procedure.
There you have it. That's what I had.
Most people have no idea what it is. Yeah, very well informed, very in charge, and a part of his medical education. He's more than just a patient.
There are a lot of good doctors. What put me over the top, as I watched a video of him on YouTube or somewhere, and he talked about how he really wanted to do this because he wanted to help people. And a lot of doctors say that. But this is a guy that talks the talk and he walks the walk. In his bio, I read that he goes to Africa and treats kids in Africa on his own dime, on his own time, just because he has those skills, they need them, and he can do that. That's talking the talk and that's walking the walk, and that frankly is what sold me on this guy, that he understands human people and has compassion. So skills are one thing, but I think what puts him over the top is that ability to connect with people and care. That sold me on him, and that's what I would say to somebody. You want a doctor? There's plenty of them. You want a doctor with a heart? This is your guy.